Have you ever felt under the weather, perhaps with a low-grade fever, some aches, or just a general sense of fatigue, and wondered what might be causing it? Many everyday illnesses can bring on these kinds of symptoms. However, sometimes these vague symptoms can be signals for something else entirely. Several sexually transmitted infections, or STIs, can indeed cause flu-like symptoms. These commonly include HIV, primary syphilis, and sometimes herpes or hepatitis A and B during their initial stages. It is important to know that these symptoms often appear in the early phase of infection, as your body begins to react to the presence of the virus or bacteria. The reason these infections can mimic the flu is primarily due to your immune system's response. When a foreign invader like a virus or bacteria enters your body, your immune system kicks into gear. It releases chemicals called cytokines, which are messengers that help fight off the infection, but they can also trigger widespread inflammatory responses throughout the body. This systemic inflammation is what leads to symptoms like fever, fatigue, muscle aches, and swollen lymph nodes, which are also common with the flu. Essentially, your body is sounding a general alarm to combat the invader. If you are experiencing any flu-like symptoms, especially after a potential exposure, it is crucial to seek medical advice and get tested. Knowing your status allows for timely treatment and helps prevent further transmission. Do not self-diagnose based on symptoms alone because many conditions share similar signs. A healthcare provider can properly evaluate your situation, conduct the necessary tests, and offer guidance on the best course of action. One insider tip is to be aware of the timing of these symptoms. For example, with HIV, these flu-like symptoms, often called acute retroviral syndrome, typically occur within 2 to 4 weeks after exposure. With syphilis, the symptoms of the primary stage might be subtle and easily missed, but the body's response can still manifest as a general malaise. Always consider recent sexual activity when assessing unusual or persistent flu-like feelings, even if you do not feel very sick. Understanding that certain STIs can present with flu-like symptoms empowers you to be more proactive about your sexual health. Recognizing these early, often vague signs and promptly getting tested is a vital step in maintaining your well-being and preventing serious health complications. Your health is a priority, and taking these steps gives you peace of mind and access to any necessary care.
If this helps you feel seen, like, subscribe, and stay healthy with us.